Hello, everyone. My name is Xiaoxi Yao. I'm a professor of health services research at Mayo Clinic, Endowed Scientific Director for Pragmatic Trials and Evaluation. I'm also an associate editor at JACC. So today we are honored to have our author, Dr. Steijn, here. Dr. Steijn, can you introduce yourself?
Of course. Thank you for having me as well. So my name is Nicole van Steijn. I am a PhD candidate at the Amsterdam University Medical Center and also at the Cardiology Centers of the Netherlands. And apart from that, a resident in cardiology. And I am the leading author of the Equal trial that I am really happy to talk about today.
Thank you. Can you give us an overview of the findings of this paper?
Of course. So what we were looking at is it's a randomized controlled trial with high-risk patients for atrial fibrillation, also atrial fibrillation-related stroke. And what we did is we gave 220 patients a smartwatch for 6 months, and the other half of the patients did not wear a smartwatch. And we found a fourfold increase in AF diagnosis, so new onset AF, in the intervention group wearing the smartwatch compared to the control group. And we also saw that they were diagnosed earlier than the patients in the control group.
So what does the study mean for our patients and our clinicians? Do you think they should do something differently, or?
What was mainly, I think, new about our project, because these smartwatches have been detecting atrial fibrillation for a few years now, but we integrated it into a clinical workflow, and I think that worked very well. So we were able to detect atrial fibrillation within 24 hours because all the ECGs that are sent in by the patients when they experience symptoms of anything, or they received an irregular notification, irregular rhythm notification by the device. And that's when they recorded an ECG, and within 24 hours, the eHealth team were able to look at these ECGs and to see if atrial fibrillation occurred. So this workflow worked very well. So in the Netherlands, this may be quite easy to do because it's already working. And I would suggest that this would be a really good way to monitor patients above 65 who are at high risk of both atrial fibrillation and AF-related stroke. However, these workflows are the easiest way to work with this. So if there are countries that don't have this integrated yet, of course, I think now after this study, it would be really good to implement it. But without this workflow, I think that would make it quite difficult to detect, because then anybody with a consumer wearable can actually record their ECG, which is really good. But you have to be able to monitor it or have somebody look at these ECGs.
That makes sense. So what do you think is the next step for this line of research, either for your group or for the community?
There is a really big trial going on. It's called the Wearable trial, who also monitor patients that are, I think, also high risk of atrial fibrillation and with a smartwatch. But they are looking at at hard clinical endpoints, so also at stroke risk, I think cognitive decline. So we do need that study to be published to know if all these patients that we now think we have to treat, if screen detected AF is always an indication for anticoagulation in patients with a high CHA2DS2-VASc score. But I think also what our group is doing is looking at other arrhythmias. So atrial fibrillation is, of course, the most common one, the most important one in terms of stroke risk. But other arrhythmias, such as high-grade AV blocks, so conduction disorders, or other intermittent arrhythmias that are difficult to detect, we can also monitor these, and we can also see these with these smartwatches. But which ones, we are also trying to find out with our other study.
One question I'm curious about that might be different for the US and Netherlands. because in the US we do, or Mayo Clinic does kind of have a similar workflow, but that's often within the context of, or the infrastructure. Mayo has the infrastructure, but how do your cardiologist or the allied health get reimbursed for monitoring these? Because within the research study, we are doing the service for free. Even we have the infrastructure when we scale to all patients above 65, it could be a large population. So how do you guys get reimbursed for this service?
Hartwacht is the program that the cardiology centers of the Netherlands already used. So that was using a handheld mobile ECG device, which is like a medical device. So that connection and that reimbursement was already there before we started this study. So we were able to integrate the Apple Watch into this system, and then it's quite easy to have it reimbursed. Of course, for the study, it wasn't yet because we still had to prove that it worked. But now I'm sure that it will be reimbursed because it's the same systems, it's the same team working to review all the ECGs. So that was quite easy, but probably the process to get it reimbursed in the beginning when I wasn't there yet was probably a longer process.
Yeah. Thank you, Dr. Steijn, for conducting this very important study. I think it will probably more and more become the standard of care in the future for every country, or I hope so.
I hope so too. I think the Netherlands is just a very, very small country with a lot of people, but in the States, I can imagine the distances you have to cross until you reach your physician are quite long. So if a remote monitoring option like this is possible in the future in countries that are that big, that would be really great.
Okay, thank you so much.